The state's COVID positivity rate has reached an all-time high of 32.8%, and many are concerned how much higher it might go. Here to talk about the current state of COVID in Michigan is Dr. Natasha Bagdasarian, the Chief Medical Executive for the state. Dr. Bagdasarian, many Michiganders are asking, vaccination doesn't seem to be working, masking up doesn't seem to be working, social distancing, all of those three together just don't seem to be bringing those numbers down. What can the state do? What more can the state do to help us?
We know that masking works, socially distancing works, and improving ventilation works as well. I think the biggest problem is that people are simply not utilizing those public health tools at the moment. And that's why we're seeing the level of spread that we are currently experiencing.
Many people who are very anxious about this rapid spread of Omicron are thinking perhaps the state should shut down again. Is that something that your office thinks about or can even do?
So we have tools. It's time to really start using those tools. We also know the negative consequences, for example, of shutting down schools. So our goal is to try to preserve as much of our vital infrastructure as we can. That includes healthcare, that includes schools, while at the same time making these settings as safe as possible. And that really means encouraging vaccination as much as possible, encouraging testing, and encouraging people to wear masks, especially high quality masks in indoor settings.
Do you believe part of our positivity rate is that so many people did get tested before holiday gatherings?
Well, I think it's wonderful if people got tested before holiday gatherings. That's what we wanted people to do. But I think that our positivity rate is not even capturing all of the testing that we have going on in the state right now, because we know that there are over-the-counter tests that people are taking at home, and those are not being reported. So the positivity rate means something a little bit different right now in the pandemic than it did, for example, a year ago. However, it's still very high. So that tells us that we're still not casting a wide enough net. What we like to do is test as many people as possible so that those who are truly positive are a small number, and that means we're not missing cases in the community. And when our positivity rate starts to climb, that indicates that we probably are missing cases in the community and that testing needs to increase.
Do you have any idea when we might be able to see this surge start going down the other side?
I think a lot of it depends on human behavior and how people choose to act right now. We have the tools. If we had 100% vaccination rates in our state, if we had people testing frequently and testing as much as they needed to, if we had people masking anytime they went into indoor public spaces, we would not be experiencing a surge. So a lot of this really depends on how long before our state comes together, our communities come together and realize this is a big problem.
All right, well, thank you for your time, Dr. Bagdasarian. If you would like more information on where to get tested or schedule a vaccination, I've got that information for you on 13onyourside.com.